my name is Sister Amy and I'm from Bonitas Baby Line. Today we're going to talk about certain foods that you can and can't eat during pregnancy. It's a very big misconception that there are many foods that you can't eat, but many foods, when eating in moderation, is completely fine for you and your baby. It's very important to stay away from alcohol. Alcohol causes fetal alcohol syndrome and can actually damage your baby's brain for the rest of their life. It's also important not to eat any raw or undercooked meat and eggs. This can cause listeriosis and cause complications to your baby. Also, please don't eat any cheeses that are like blue cheese, camembert cheese or brie cheese, as this is unpasteurized and can cause problems for your baby. Please stay away from any foods high in vitamin A, such as liver or liver pate. Also, no food or eggs that are undercooked. Any eggs that are undercooked can also cause listeriosis and cause birth defects in your infant. Stay away from scrambled eggs that aren't fully cooked, or also hollandaise sauce and mayonnaise. There are many foods that you can eat, and there's no fruit that's restricted or vegetables that's restricted, as long as you wash them properly and the produce is clean. Also, it's very important to eat a very balanced variety diet that includes all your green leafy veg, your orange veg, and your yellow veg. Back pain is a common problem in pregnancy. Back pain can be uncomfortable and even painful. It's important to know that when you have back pain, the pain shouldn't last more than 2 weeks, and then you need to consult with your gynecologist. Back pain is caused from the softening of the ligaments in the body due to pregnancy and the hormonal changes you might face. Back pain is very uncomfortable, and it's important to rest and to know when to rest. Not picking up heavy objects, not lifting and not reaching for high objects, because that could put even more strain on your back. Heat and cold work very well in relieving back pain, such as cold compresses or hot water bottles. No Voltaren or any gel should be used during your pregnancy when you suffer from back pain. It's also important to drink lots of water, to keep well hydrated, to eat a balanced variety diet, and to take your multivitamins as you should. Braxton Hicks. Braxton Hicks can start from about 6 weeks of pregnancy. Braxton Hicks are known as sporadic contractions and relaxations of the uterine muscles. It might feel like labor pains, but labor pains are much and far worse than Braxton Hicks. With Braxton Hicks, the pains might come every 30 minutes, every 45 minutes, and may be uncomfortable. Braxton Hicks are not painful, and they should not be painful. If the Braxton Hicks occur in periods of shorter than 30 minutes, please consult with your gynecologist. Braxton Hicks is often referred to as false labor or prodromal labor pains. And with this, it gets your body ready for labor, for when labor is going to begin. Swollen feet and hands can be very unsightly and make you feel very uncomfortable. But please know that this is normal during your pregnancy, as this is caused from extra fluid in your body and the pressure from the uterus. With extra swelling, there's a lot of extra fluid in your body at the moment, with about 50% extra blood flow. With this extra blood flow, it may make you feel very uncomfortable and make you feel very swollen. With this, you need to rest and lift your feet up for at least 30 minutes every day, to stay off your feet and to wear the proper shoes to support the swelling. Also, it's important to know that if your face swells drastically overnight or during the day, to consult with your doctor, because this could mean an increase in your blood pressure. Baby's movements. Some women may feel baby's movements from about 16 weeks of pregnancy, but please know that it is quite normal to only feel some movements from 22 weeks of pregnancy. Movements may feel like a swish in the stomach, a bit of heartburn, or even butterflies. Please know that if you haven't felt movements by 23 weeks, it's important to consult your gynecologist. Baby is still very small at that stage, and it is not uncommon to have no feelings yet. It is very important to take multivitamins during your pregnancy, and it's also important to take folic acid for the first 12 weeks in your pregnancy, as this increases baby's brain development and reduces any chance of any spinal deficiencies such as spina bifida. There are many multivitamins on the market. Choose one that suits you, that suits your budget, and that suits your baby. Nausea is very common during the first 12 weeks of pregnancy, but nausea can also carry on for the entire duration of your pregnancy because of hormonal changes in the body and the effect that it has on the stomach. With nausea, it's important to eat properly, stay away from the gassy foods, the spicy foods, and the fatty foods. It's also very helpful to sip little bits of water and to suck on ice cubes. Also eating dry crackers and ginger. Ginger can come in the form of ginger beer, ginger ale, or ginger biscuits. Vomiting can be uncomfortable and make you feel really terrible. If your vomiting is continuous, please consult your doctor as you may become dehydrated. With vomiting, there are different medications that you can take, and there are different shakes that you can take in case you feel like you're not getting enough vitamins. But please know that vomiting and nausea will not harm your baby unless you become exceptionally dehydrated. It's important to know the danger signs in your pregnancy and when to go straight to the hospital or to consult with your doctor. One of them being bleeding. Any vaginal bleeding that's running down your leg, that might be in your panty, it's important to go and see your gynae immediately, as this could mean that your baby is in distress. It's also important to know that it's not good to have headaches for longer than 2-hour periods at a time, and also having any blurred vision. Any blurred vision and headache along with dizziness could be a problem, and you need to consult your doctor immediately. Also, any pain that lasts for longer than 2 hours or your stomach having continuous contractions, please go into your nearest emergency center. Also, if your baby is moving or moving too little, please note that if your baby is moving less than 5 times in 1 hour or 10 times in 2 hours, this could be a reason for concern. If you feel like your baby is not moving enough, lie on your left side on your bed and drink a cold glass of water or eat a chocolate. This will increase baby's movements and count them. If it's less than 5 times in 1 hour or less than 10 times in 2 hours, please consult your doctor. It's also important to notice any liquor or any water that's running down your leg or might have popped. It's important to go straight to your emergency center so they can assess if there's any reason for concern. There's a lot of hormonal changes in your body while you're pregnant, and this can sometimes cause diarrhea and constipation. Constipation can be uncomfortable and can even become sore. Unfortunately, there are not many medications on the market that you can take during your pregnancy, but please consult with your doctor if it gets too painful. With constipation, it's important to eat a diet high in fiber, such as dried fruit, lentils, and beans. Also, to drink enough water and at least 1.5 liters a day. Eat your green leafy veg and stay away from any laxatives, as this could cause harm to the baby. With constipation, you can also have a nice warm bath, you could get someone to massage your stomach, and you can also make time for the bathroom and not leaving it when you feel the need to go. With diarrhea can also be caused by your pregnancy and the effect that it has on the bowels. With diarrhea, it's important to realize when you are becoming dehydrated. If you are going for more than 24 hours and it becomes too watery, it's important to consult with your doctor to get a medication to stop. Heartburn is very common in pregnancy, and it's also very frequent. It can last for 12 weeks and it can last the entire duration of your pregnancy. To relieve heartburn fast, drink milk that is pasteurized or any of the anti-heartburn medication on the market. It's also important to lie on a pillow that's a little bit higher in your bed to relieve some of the discomfort. It's important to stay active during your pregnancy. This doesn't mean overdoing it, and this is also avoiding any high-intensity athletic programs. Some exercises that you can do and that are very good for you is walking, swimming, and any prenatal yoga. If you have any further questions, you're worried about something, or you just have a query, please feel free to phone us 24 hours of the day on 0860 099 9121. Thank you for watching.